In this video, I am going to talk about the assessment of pulp vitality. Introduction. The accurate diagnosis of the true histologic status of the pulp is of significant importance for the treatment planning. This is indirectly done by assessing the neural sensitivity of the pulp. The more accurate method would be to assess the vascularity of the pulp. Methods of tooth vitality assessment: neural sensibility test and the pulp vascularity test. Under the neural sensibility test comes the thermal test, electric pulp test, anesthetic test, and test cavity. Under the pulp vascularity test comes the pulse oximetry, laser Doppler flowmetry. Others include dual wavelength spectrophotometry, thermography, and crown surface temperature. Neural sensibility test. They work on the principle of stimulating the neural fiber present in the pulp. Thermal test. These tests involve the application of cold and heat to a tooth to determine its sensitivity to thermal changes. Heat test. The materials used for the heat test are electrical heat carrier, hot gutta stick. Others include hot water under rubber dam isolation, hot burnisher, hot compound, dry rubber polishing wheel. The area to be tested is isolated and dried. A suitable lubricant like Vaseline is applied. Heat is directed to the exposed surface of the tooth and the patient's response is noted. A heat carrier instrument that can deliver a controlled temperature to the tooth is preferable, or a hot gutta stick can be employed. The heat is applied to the occlusobuccal third of the exposed crown. If there is no response, the hot substance can be moved to the central portion of the crown or closer to the tooth cervical margin. When a response occurs, heat should be removed immediately. For the application of hot water, the tooth to be tested is isolated under a rubber dam. The tooth is then immersed in coffee hot water delivered from a syringe and the patient's reaction is noted. The response is limited to the tooth tested. Next comes the cold test. Materials used for the cold test are endo ice, CO2 snow, pencil of ice, and ethyl chloride. The most common method is to apply the cotton pellet saturated with 1,1, 1,2 tetrafluoroethane to the tooth being tested. The another simpler method is wrap a silver of ice in wet gauze, place it against the facial surface of the tooth and compare the reaction to a control tooth. Tachi and Associates recommended that a quarter-inch diameter cone of ice be placed against a tooth for 5 seconds to quantify the cold testing. Carbon dioxide snow has also been used for the application of cold to the teeth. The use of dry ice has been described by Ehrman. Because the temperature of dry ice is minus 78 degrees Celsius, one is able to penetrate the full coverage restoration and elicit a reaction from the underlying tooth to the cold. Electric pulp test. The electric pulp test uses nerve stimulation for testing the pulp vitality. It is applied by increased electric current to the tooth. If there is a positive response, it indicates the vital pulp. If there is no response, it suggests pulp necrosis. Pulp test or components: probe tip, rheostat, metal sheath, and the lip clip. Procedure. First, explain the test to reduce the patient's anxiety. Isolate the tooth using cotton rolls and saliva ejector. Dry the tooth crown thoroughly. Check tester function before use. Always test a control tooth first. Application technique. Apply the electrolyte to the probe tip. Place the electrode on anterior teeth at the incisal third of the crown. If in case the posterior teeth, mid third of the buccal cusp. Avoid contact with the metal restorations or gingiva. Completing the circuit, ground wire or the lip clip placed on the patient's lip. Alternative method is the clinician touches the metal shaft of tester. Ask the patient to respond when sensation is felt, like tingling or warmth. Testing and interpretation. Increase the current slowly with the rheostat. Record the reading at first sensation. Repeat for each tooth. Compare responses with the control tooth. If there is no response, it is possible for non-vitality. Common errors and precautions. Avoid the testing on wet or restored surfaces. Ensures good isolation for accuracy. Recheck the results if inconsistent. Switch off the unit before changing the teeth. Clinical interpretation of EPT response. Normal response. Same threshold as control tooth indicates the vital pulp. Negative response, if there is no reaction even at the highest current, it indicates the non-vital pulp. Early response, lower threshold, inflamed pulp. Delayed response, higher threshold, indicating the degenerating pulp. False responses, false positive and false negative. False positive, gangrenous pulp with vital tissue in the root canal, multi-rooted teeth with partial necrosis. False negative, extensive calcification, fibrotic pulp, recently traumatized teeth. Sedative dressings or high pain threshold. Clinical notes on EPT. Best done with the cold test. Unsuitable for immature permanent teeth. Not for concussed or full coverage restored teeth. If the restoration blocks stimulus, the test cavity or other methods are indicated. Cold test is the most effective for immature permanent teeth. Anesthetic test. It is used when the patient is in pain and the pulp tests are inconclusive. This procedure is conducted by anesthetizing the most posterior suspect tooth, continue anteriorly until the pain disappears to identify the source. Indicate specific tooth causing pain. Advantage, no iatrogenic damage like test cavity. Test cavity, it is used when all of the test fails. Procedure, drill through enamel dentin junction without anesthesia. Use high speed with the water coolant. If there is pain or sensitivity is felt, the pulp is vital. If there is no pain, pulp is likely necrotic. After confirmation, sedative cement may be placed. Pulp vascularity test. Assess the blood supply rather than the nerve response. Two main techniques are employed: pulse oximetry, laser Doppler flowmetry. Pulse oximetry. It is a non-invasive method for measuring the oxygen saturation. It is based on absorption of red and infrared light. The components of pulse oximetry are light emitter, photodetector, pulse oximeter monitor. It measures the pulsatile blood flow, indicates the vitality. It is still under the development for dental application. Laser Doppler flowmetry. It is a non-invasive method to assess the rate of blood flow. It includes laser beam is transmitted through a fiber optic probe. Probe placed on the tooth surface measures change in light frequency, indicates the pulpal blood flow if there is pulp vitality. Thank you.